This is a demonstration of Allscripts Professional EHR for urology. Today we're going to demonstrate how Allscripts Professional EHR can overcome your daily challenges and help you achieve meaningful use. In urology practices, most providers are challenged with referring provider notes, quick and easy access to labs and procedure results, triage of phone messages, procedure notes, and too much time spent documenting visits. Allscripts Professional EHR can help make your life a lot easier with encounter packs for easy referral letter generation, result notification, messaging, easy access to procedure notes from the face sheet, and quick review and documentation of previous visits. Now let's take a look at how Allscripts Professional EHR can help meet your needs. Here you're logged in as Cindy Pope, who is the nurse in this scenario. Cindy is looking at the schedule for today, all the patients that are scheduled to come in, and their appointments. The black text indicates the patient has not yet checked in. If the patient's name is in blue, that simply means they checked in and are sitting in the waiting room. The green indicates the patient has been seen by the nurse and has been placed in an exam room, and the red means the patient has checked out. The patient for today's scenario is Della Davenport, who is here for chronic UTI. When you open her chart, immediately you get a reminder that she needs a smoking assessment and a repeat cystoscopy in a year. Her face sheet shows her entire chart, her problem list, her past medical, surgical, and family history, her allergies and meds, and her social history, the encounter display, her office visits and consults, her medications list, and any orders that have been processed for the patient. Next, you'll document the patient's visit. She is here for a chronic urinary tract infection, so you'll start by capturing her vitals and pull in her previous height and weight. If she has gained any weight, you can indicate that here by making a change. As simple as that. Once you have added that to the patient's record, the trend has been captured into the chart with her weight and height. Her body mass index has been calculated automatically off of the height and weight. Her history has been documented in the visit from previous visits, and it stays in the chart. Everything that has been documented previously in her encounter displays here. To pull it in for today's visit, you should select Include Active. All the information is pulled in for today's current encounter. It is simple to make any changes that need to occur. For example, the patient tells you she is allergic to penicillin, so you need to update that history with penicillin allergy. Choosing from the template list of choices, select the penicillin and then also select her allergy. Her history has been updated. Next, her medication list. You want to pull in her previous meds list here. Select Include Current, and it pulls in that she is currently taking Celebrex. Her fill history will allow you to pull in any medication that has been prescribed to her from other providers, as long as she used her insurance to fill those scripts. So, if you want to pull her fill history from any other provider that has written her a prescription, you can pull that right into her chart. Once that's been documented, you can reconcile that her medications list has been reconciled and you have met a meaningful use requirement. Her social history indicates here that she is a non-smoker, and her smoking assessment is up to date as well. Here is the actual visit as it looks now. Next, you'll send the chart to the doctor, who will document the remainder of the visit. The nurse is putting a sticky note on the chart just to alert the doctor of what's going on with the patient. Now you log in as Dr. Plummer, who is the physician for this scenario. He is looking at the same schedule that the nurse looks at. However, on the right, you'll notice the inbox, or what are called queues, for that provider. All the work that needs to be done throughout the day or through the week. Received charts shows where the patient is roomed. So, Della Davenport is in exam room 6, and when you select her record, it displays the sticky note that was put on by the nurse. At this point, the doctor can review any reminders that popped up. The smoking assessment has been completed, and the doctor wants her to have a repeat cystoscopy in a year. Here is the face sheet, and now the doctor is going to go in and document her chronic urinary tract infection symptoms. So he selects that from the pick list in the template and starts to document the problem the patient is experiencing. She is having urinary frequency and urgency and also some pain. She noticed the pain is in her back and it is not radiating. It seems to be getting worse over a period of time, and as you document using the template, if you notice at the bottom, it actually creates the note. Any associated symptoms. No chills, fever, or nausea. However, she's just urinating at night and also a slight vaginal discharge. As you add the negatives and positives, it actually describes that for you in the note here very easily. She's not taking any current treatments, and there are no disease complications. So at this point, you move on, documenting the review of systems for this patient, and you can actually pull in a template for urinary tract infection from the patient's last visit. Once you pull that in, it documents right on the chart. And if you need to make a change, certainly you can do that by documenting that she is having painful urination. You want to show that in the review of systems so that it is counted towards the billing. Same rule applies in the physical exam. The template is already in place from the last visit. You can select the one visit that you want to use and apply it to today's visit. If there are any changes, certainly you can do that and indicate she is experiencing tenderness and inflammation. You just made those changes in the visit. In the assessment and plan, you'll notice here at the top you have protocols. In the protocols, you will notice ICD-9 codes are already built in along with the appropriate treatment plan based on that diagnosis. So, this patient is here for a urinary tract infection. Here is the ICD-9 code for billing purposes. You simply select that code and then add it to the patient's record. Once the protocol for urinary tract infection is drawn from the patient's current plan, you'll notice the peridium was not covered under the patient's insurance because it's not on her formulary, which is indicated by the red X. Once the prescription pad is open, you have the ability to choose an alternative medication which is equivalent to the patient's current med. You select it, write the new prescription, and that is now displayed and ready to be e-prescribed to the patient's preferred pharmacy. The final note looks as follows. At this point, if you're ready to sign off on this visit, select the E&M calculator. You look at the note and based on the selections, it suggests the level of service. The diagnosis has to be qualified. This is a new problem with an additional workup plan. You did write a prescription and you'll calculate. The system is displaying a 99214, and the summary sheet tells you exactly why this score was given. The history was comprehensive and the exam was expanded. So if there was anything else you need to do to achieve a higher level, it would have given that information here and here. Once you're ready to sign off, you have the ability to automatically generate the super bill. The super bill shows here, pulling in that CPT code for billing purposes along with the ICD-9 code for today's visit, and then any billing codes for labs. The clinical summary meets a meaningful use requirement where it will generate a summary of the visit based on today's encounter. E-prescribing is displayed here. Here is the patient's preferred pharmacy and the actual prescription is being written. Also, the letters will generate for the clinical summary, which is a meaningful use requirement, and also a referral letter back to the referring doctor. The referral letter shows here automatically, pulling in the doctor's referring name along with the information coming from the progress note and is now displayed in the letter, along with the treatment plan and the doctor's signature. This is an actual letter that can be customized and edited on the fly. If you want to make a change, for example, the patient is not very pleasant and you want to take that out of the letter, that change can be made right away. The clinical summary is displayed and pulls directly from the progress note. This clinical summary will be ready for the patient at the time of checkout. Back over here to the cues, you can quickly see lab results and procedures that have come back into the patient's chart. The result notification shows any lab results or procedure results that have come back directly into the patient's record. Those items in red are abnormal, and those that are black are normal labs. To review a lab result, you simply select the results you want to see and review the lab. To sign off, you place your signature there, and if you want to publish the lab results to the patient, that can also be done through the portal with a comment to the patient. Messaging is a quick and easy way to communicate to your staff regarding a patient chart or anything that provider needs to be reminded of. For example, if the patient calls regarding some burning upon urination, the message would be sent from the nurse to Dr. Plummer's inbox. If the doctor wanted to pull the patient's chart, he could do that by quickly selecting the face sheet and getting right into the patient's record. To reply back to the nurse, simply hit Reply and type the message to the nurse or dictate it. It goes right back to the nurse and comes off of the doctor's inbox as well. Allscripts Professional EHR not only addresses your daily challenges, but connects to 180,000 physician users, or every 1 in 3 physicians uses our products, 1,500 hospitals, third-party devices and applications, labs and pharmacies across the country. Allscripts practice management solution seamlessly. The Allscripts referral network. To patients through the patient portal. To patient charts remotely with our Allscripts remote for Apple iPhone, iPod Touch, BlackBerry, or any Windows mobile device. It is your entire healthcare community connected. To request a custom ROI assessment or a personal product demonstration, please call Allscripts at 1-877-EHR-NOW1 or email ehrnow@allscripts.com or visit www.allscripts.com/professional.